What's up, you guys? It's your boy Miguel here to give you your daily dose of radiation. In today's video, we are covering how often or when in the real world of radiology do the lead apron are used. So, to give you context, I'm a night shift Xray tech. I've been doing it for over 4 years. Work at a trauma 3 ER in the state of Texas. So, lead aprons, all the leads and shield. So, in school, you were taught to always wear your lead, protect yourself, 6 feet distance, and keep the pregnant people, safe, shield them, shield little kids, shield as much as possible. So, in theory, this is correct. But the sad reality from what I've seen, if you're a veteran tech, most of them don't wear aprons, any kind of protections when they're holding patients, when they're holding babies down. With that, most of them has given up. I think usually after any tech has been doing it for more than 10 years, most of our veteran techs, I rarely see them let up. Certain ones do, other ones don't. But then again, that all comes down to everyone's situation or whatever they got going on. I don't know. But they don't. But all of us as techs, any kids, we will, shield them. We will protect them, because they're still young. But as far as because most of the time when I have to wear lead, it's because we have to cross table. It's because we're in the trauma room. And the trauma room too, there's certain nurses that a patient comes in and he's really, really messed up, and we'll have to shoot and they gotta do their nurse stuff. Some of them will let up. Other ones choose to play the game of stepping in, stepping out. And in certain cases, someone's getting zapped because we yelled. They didn't move because they weren't paying attention or they were doing their own thing. But the doctor told us they really need the images. I've always felt the need that I will always ask anyone before I shoot. There's other techs who don't. They just, shoot and they don't really care. But I always give everyone the benefit of the chance if they do. Some of the nurses wear lead as soon as trauma, they'll slap on lead, and then, which is better for them. They can do their stuff and I can do my stuff and everyone can work in harmony. So I always wear lead. I'll always wear lead regardless of my age, regardless how long I do this, just to be safe. Obviously, you don't want to be holding and doing stuff. Basically, lead is I have to do it to get this image done. And it'll be more of a last resort, or if the patient is unable to be optimally with the tube angle and adjusting of the board and using all your resources before you have to, let up. That's kind of how we roll. Or if we're super, super slammed and it's one of those cases hey, for job efficiency, let's just slap on some lead and we just, knock this out 1, 2, 3 type of situation. Because certain patients, because of their pain or because we're hella slammed, it's just easier to operate differently, I know that in the NICU, a lot of the nurses wear lead. Some of them don't. The babies, they have a little tiny gonad shield they wear. Other people, you shoot them, you always ask if they're pregnant or not, before. Even though the sad part about that is, even if they're pregnant, they will still get x-rayed by the doctors. Even though we tell them, hey, they're pregnant, they always hit you with the same thing. Well, the images are justified, or the dose is justified because we had to keep the mom safe. If the mom's safe, blah, 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 whatever. And I'm you're not wrong. But for legal purposes, I have to tell you, or we got, inform, the people. And even in your notes, like patient was pregnant, patient was shielded, whatever, just to keep you safe, because you never know if later in the future something happens and you get involved in the beautiful AART court and you're in trial. So, but a lot of day shift will always play the game of, oh, we're waiting on the preg test. Or, I would do it, but I would hate the shield, and then she's pregnant. And then to end up still doing it. And I'm like, well, you could have just put on lead on the patient and still got the exam done, regardless if she was pregnant or not. But then again, there are some patients that if they don't know if they're pregnant, or even if they know they're pregnant, they don't want it. So there's always that. At the end of the day, it comes down to the patient, and you always informing them, like, we can do this, there's a risk of this, we can put lead, but still cancer, still mutating, with the radiation. So to each their own. But for the most part, I would always wear lead. Distance, sometimes you'll be in rooms where, depending on how you positioned or have to be positioned, you can't escape. Someone gets locked up, and the best thing is to wear lead and just turn around. Keep yourself to the back of the room with lead. Sometimes it'd be like that if there's too much action going on in the emergency room or wherever you find yourself in doing images. That's sometimes where you would still be wearing lead and stuff. But overall, that's about it on that. On that note, today's sponsor is me. You can check out any of my videos to inform you in the daily dose of radiation. And if you want some Xray memes, you're more than welcome to check the link below. I have my TikTok where I post just the memes of the radiology humor involving the anime, because the YouTubes, they don't like it when I post over here because of copyright stuff. They don't really, is this better? They really don't like us posting stuff like that. So over there, you'll find the memes and stuff like that. And you can check out my channel for everything involving this beautiful world of radiology. And we'll see you on the next one.